Hello everyone, welcome to financialexpress.com. 2 years ago, the life was going normally when pandemic hit us. Pandemic has changed most aspects of the life, but the one thing that it has changed the most is the healthcare sector. Healthcare sector has seen a plethora of changes, and most of them are brought by the advent of technology. Because of the pandemic, people could not visit medical facilities. So technology played a huge role in providing healthcare to a lot of people, which were far and across the country. Many companies came up, and many healthcare firms adopted technology and made healthcare simpler and more effective for everyone. Optum Healthcare is one such healthcare company that is connecting every aspect of health and personalizing healthcare by making it smarter. We have with us Paul Neilson, VP Strategic Programs, Optum Technology. Welcome, Paul.
Thank you. Thank you for having me here.
So my first question to you would be, how has healthcare transformed in recent times, owing to this pandemic and all the changes that are happening in the technology?
So that's a great question. As you just articulated, when the pandemic hit, everybody had to go home. So our whole workforce had to move home internationally. I have children. All my children had to go home and learn virtually. So we had our lives turned upside down. From a healthcare perspective, we weren't able to visit our primary care just for a wellness visit, never mind an urgent care visit, as those clinics were closed. So what we did was, and the industry as a whole did, is start implementing telehealth type of services. So think about FaceTime, right? And literally some providers used just what you could use right here, Zoom, or other tools to do virtual visits. But over a very quick period of time, that started to be more mature and more secure, because obviously we're dealing with healthcare and PHI and PII data. So we had to build very quickly a telehealth platform to do virtual visits, and whether it's just a wellness or urgent care. And then from that, though, we found that our members, and that's how we look at our patients as members, they liked the virtual setting first. So they actually don't want to return to having to schedule an appointment and then wait for that day and time to come up, drive to the provider's physical presence, and then sit in the waiting room to be seen. They'd rather have that first visit virtually. And with the tools that we're starting to see the industries developing, the startup community in particular, and some of the larger device manufacturers, medical device manufacturers, the clinicians can determine quite a few things now virtually by collecting biometric data from the member patient remotely and looking at it in real time to determine, is there a fever, some is the blood pressure high, things like that you can determine with remote devices like blood pressure cuffs, and even your wearable, your watch, iWatch, captures heart patterns, right? So the industry's changed dramatically, and it's not going back. It's just going more virtual.
Yeah. So in your view, what role does technology play in boosting the innovation we are seeing in the healthcare?
It's a huge part of it, right? We had to build these virtual connections and these platforms, essentially, that let's say you're the provider and I'm the patient, we can interact with right now in real time. And then we need to provide a kit, if you will, that our members will have at their home that they can use, that are simple enough for just a regular consumer to pick up and use to collect that information, that medical information that the clinician needs to make the diagnosis. That being said, there's a tremendous amount of technology that has to come to the house or come to the market, right? A lot of it obviously is wireless. A lot of it is, based on probably using over-the-counter devices like iPhones and Android and other tablets and things like that. But then there's, of course, the technologies that are looking to get medical grade information from the patient. So that's where you'll have to have FDA approval, class 2 approval, various CE, CL type certifications, right? Because these are devices that will be in the hands of the home. They have to be safe, et cetera. And they have to adhere to HIPAA, right? And all of the security requirements around the PHI data that will be transferred between the clinician, the care provider, and the member.
Yeah. So all this happened, and the health tech and health telemedicine are growing really fast. Many startups are coming now. How do you see this new startup ecosystem contributing to the health tech sector?
I think it's like every industry at some point goes through a major transformation. And really where that innovation starts is at the startup, at the garage level, so to speak. Large corporations are so busy continuing to maintain their existing infrastructure. It's hard for them to create that next generation, that leap in technology, because they are so busy maintaining their current operations. The startups are really where you see that innovation happen. And you see this over and over again. Like I said, in every industry will go through a change, a transformation. Healthcare is there now. We're going through a dramatic transformation. We had already started going from, let's say, the analog to digital. We were digitalizing, a lot of our records, right? We're trying to create portability around the IHR record, interoperability between EMRs, right? That's been ongoing. Now with telehealth, that's another major transformation for this industry. And the startup community is really what will drive that change. They'll start it, no pun intended there. And then typically what will happen, they'll get acquired by a large company that can then take their technology and make it scalable to what the industry needs.
Optum has recently launched its Optum Startup Studio program. Please elaborate about it and share its objective with us.
Yeah, so Optum Startup Studio, going back to the very beginning, I think it was 4 years ago where we launched the Optum Startup Studio in the US. And the intent of that was, it was a strategic incubator for early stage companies in the healthcare industry. And our goals there were to be able to obviously see what's coming, right? Have an early look of some potential disruptive or really transformative technology. Incubate technology where we would curate, we'd be looking for companies that have solutions in very specific spaces that we see that is a need right now. Obviously, it's strategic, so we were looking first for our needs, but obviously we want that to be something that can be applied to the industry. So we looked for technologies in the areas that we were focused on. So call centers, for example, was one where trying to automate, a call where a member calls in to see if they're eligible for a particular procedure, right? Now, fintech, banking, they've had bots out there for well over 10 years or more, right? Where a lot of times you and I call your bank, you're talking to a bot and you don't really even know it. But we need to do that in the healthcare space. So we started looking at those kind of areas to make the experience better. And then now that COVID happened and we're going to telehealth, we're obviously looking for clinical technology or platforms that can allow us to move the clinic in the home, if you will, so that we can have those virtual visits, right? And our members don't have to leave the house initially unless it's determined that they have to go to a specialty place. So that being said, the Startup Studio was founded to do just that, to find these early stage companies, help them. We provide mentorship, from the line of business that is relevant to the company, right? And then hopefully, if things go well, they'll find themselves in a pilot, and then we can, see how really well it works. We help them mature their technology and business model to succeed. That being said, fast forward to this year, we launched the Optum Startup Studio India, which is very exciting. India, there's an awful lot of innovation happening. I probably don't have to tell you that there, across all of the major cities, there's so much innovation happening, through, graduates from double IT or triple IT or the other, technology institutes. Some of those institutions have their own incubators, which is a common model, and that's a funnel for our incubator. So a partnership with these institutions are important and part of our strategy. And so we want to replicate what we did here in India, so we can see, have a broader view of what technology is being innovated in the healthcare space globally. And then that way we can, obviously try to identify those companies and technologies that really would be impactful. And then we can work with that company, partner with that company, help them mature it and help bring it to market at scale.
One of the objectives of the Optum Startup program is reducing the cost of healthcare. How are you planning to achieve it for the patients?
Well, I talked a lot about the current processes. A lot of these processes are manual in the background, right? Claims adjudication, benefit eligibility, prior authorization. These are some of the things in the back office that are done today manually. That adds a lot of cost and time and delay in getting care. So we're trying to digitize, automate that. That will reduce the cost of care. And then moving the clinic into the home, so to speak, where we can virtually first visit our members, right? That's going to reduce their time out of work, the time commuting to a physical location. That's cost. Energy costs have gone up significantly, right? As we all seen, inflation. That will reduce the cost. And being able to make, in almost near-time diagnoses using AI, ML, the data that we're capturing from these devices that the member has, whether it's a wearable or it's a blood pressure cuff that is connected via Wi-Fi or Bluetooth. When we capture all that data, we have these models running in the background that can help quickly diagnose the condition for the provider. We're not saying it would replace the provider by any means, but it could take a possible 100 potential causes of these symptoms down to 10, right? So that the clinician can quickly determine, of the 10, yes, this is an ear infection, let's say, or this is an upper respiratory infection, and I'm going to prescribe you antibiotics.
So if there is a health tech startup, somewhere in India, how can it connect with healthcare Optum's startup program?
So we have Optum Startup Studio India website. It's a URL, and I think we can provide that to you or to your members. And that's the first place to go. There is an application page that you just enter your very simple information, who you are, company name, a brief description of your product, and you submit it there. And then one of our team members will reach out to that company, that individual, and set up an interview, if you will, to learn more about the product. And from there, we run cohorts once a year. They tend to start around September, early September, and they'll run through April. And we look for 8 companies to fill that cohort. Currently, we plan to expand that, but that's how you'd contact us. Through the website would be the first place to go.
Okay, so you are working globally as well as you are working in India. What is the difference you see in the health tech startup sphere globally vis-a-vis India? Any insight that you can share, particularly with respect to India?
Well, I think one, we all have the same need in terms of virtual platforms, technology, wearables, capturing that clinical grade biometric information. Obviously, markets are different in terms of whether it's single payer systems or multi-payer systems, private, public, combination of thereof. So there are differences there that some technologies would not apply to one market or another, right? But I think overall, India, simply, again, because of the large number of institutions you have there, the volume of innovation that India can produce is much greater, I think, than many other places in the world, to be honest. But I think that, as mentioned, there are nuances per market. And so, we have to keep that in mind. But the foundational technology, I think, is similar that we all need across the globe.
India and China are two places which also have strong alternative medicine system. Like in India, we have Ayurveda, we have yoga, we have Unani, and then we have naturopathy and all. So is it also open for startups in alternate medicine, or is it only for allopathy?
No, I think it is open. I mean, we have had startups in our past cohort in the U.S. That would prescribe diets, for example, right? That so you live healthier.
So nutraceutical companies also are coming up in a big way.
Yeah, and large companies are looking at programs for their employees, again, to live healthier. So they're offering incentives to exercise, yoga, right? To behavioral therapy programs to reduce stress, right? Diet is another one that I think we tend to ignore how impactful a diet can be, to your health and longevity. So those are things that we're very open to.
Okay, my last question to you is where do you see this program and the health tech sector in 5 years from now? What is the future look like?
My vision, I think, is that I think you'll see more and more of these healthcare partnerships coming up with healthcare entity like United Healthcare Group, Optum, partnering with a research institution or more, one or two, and then an incubator, local incubator with our incubator, so that we create kind of a journey from those who go to a technology institute. They learn specific skills, whether it's a machine learning, data science, AI, whatnot. They have an idea that it could be impactful for healthcare. Between our incubator, the university incubator, we give them an environment that can help them actually take the idea to a MVP, a minimal viable product, and then we build a forum that they can demonstrate that MVP to a broader audience that's in healthcare, and that could be other healthcare providers like us, or venture capitalists or investors to help them again continue their development journey, and or lines of businesses that they can put to get their technology into a pilot to validate its goal, right? It's what it was built for. So I think you'll see much more of that going forward. There's the healthcare industry is such a large enterprise, if you will. If you think about the whole ecosystem, that it's going to take a lot of effort to transform. It's a very old industry, and it hasn't changed much over the last 20, 30 years, really. There's an awful lot of requirements to transform, a lot of digitalization, automation, a lot of interoperability that has to happen to make it really seamless. So to do that, we need the startup community. So I think the startup community here is going to grow.
That's really insightful. Thanks so much for talking to financialexpress.com. Thank you very much.
Thank you. Thank you for having me here. It was a pleasure.